everyone, and thank you so much for joining the NeedyMeds special topic webinar, the PAN Foundation, Connecting Underinsured Patients with the Treatment They Need. My name is Carla. I'm the Director of Education at NeedyMeds, and before we get started, I just want to go over a few tips. You can type any questions you may have about the presentation into the questions section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't have the time to answer your specific question, we will follow up with you personally via email after the webinar, probably by tomorrow afternoon. But of course, we will provide the contact information for both the PAN Foundation as well as NeedyMeds if you have questions that need to be answered right away. Also, the heads up that this webinar is being recorded and it will be available for viewing on the NeedyMeds YouTube page. We try and do that pretty quickly, so probably by the end of the week. So let's get started. For those of you that are not familiar with NeedyMeds, there's a slide just with our updated mission statement. We actually revised our mission statement in 2016 to more accurately reflect what we do, which is that we are dedicated to educating and empowering those seeking affordable health care. And we define the education part of our mission really in two ways. First of all, of course, by letting people know about NeedyMeds and the resources we have to offer, but also by letting them know about other resources such as the Patient Access Network Foundation, or PAN. And again, their mission statement is that they are dedicated to helping underinsured people with life-threatening chronic and rare diseases get the medications and treatment they need. I always put a slide of the NeedyMeds homepage also up there because really our website is the face of our organization. And I'm going to leave that up while I introduce you to today's guest, Aisha Azam, who will be walking through today's presentation. So Ms. Azam is the Senior Director of Medical Affairs at the PAN Foundation. She manages PAN's medical provider and pharmacy outreach, and ensures that PAN's providers and pharmacies receive high-quality customer service from PAN's call center and claims administration partners. Ms. Azam has a Bachelor of Arts degree in Liberal Arts from the University of Missouri, Kansas City, and a Master's of Science degree in Health Informatics Administration from the University of Maryland College. So you can see why we're so excited to have her with us today. So without further ado, I'm going to go ahead and pass the mic and the screen to our guest, Aisha. So bear with us. I'm going to try and do that as smoothly as possible. So Aisha, you can go ahead and take it away when you're ready. And a reminder to everybody, if you have questions while Aisha is conducting the presentation, you can feel free to type them into that question section of your GoToWebinar control panel. Enjoy the presentation. Aisha, you're all set.
Thanks so much, Carla. Hello, everyone, and thank you for joining us today to learn about the PAN Foundation. My name is Aisha Azam, and like Carla said, I head up the Medical Affairs team here at PAN. Today, I'll walk you through what we do, why we do it, and how you can apply for and receive assistance. Access to medically necessary healthcare is critical for successful patient outcomes. Yet access is often impeded or blocked entirely by cost sharing. Cost sharing refers to healthcare expenses that are not covered by an individual's insurance plan and must be paid out of pocket. These out-of-pocket expenses come from deductibles, co-payments, and co-insurance. People who have insurance yet are unable to afford the out-of-pocket costs not covered by the insurance company are deemed underinsured. Additionally, someone is considered underinsured if a person's medication expenses is more than 10% of their annual income. For people with a chronic or life-threatening illness, the cost of care can add up quickly. The underinsured population spans across Americans for all ages and income levels, affecting between 25 to 30 million people. In many cases, out-of-pocket costs reduce or prevent access to prescribed medications, and this negatively impacts both quality of life and the course of disease. Limited access to prescription medications excludes economically vulnerable patients from the benefits of new drugs, specialty drugs, high-cost generic medications, and other medically necessary high-cost prescription medications. In many instances, even modest out-of-pocket costs associated with lower-cost drugs can prevent access to medically necessary treatment. It's clear why this is such a problem, and these concerns are not leaving us. Advancements in therapy could mean even higher prescription costs, and an increasing cost-sharing burden falls directly on patients. Increasing health insurance premiums means that patients who are already having difficulty paying for their medications will need to pay more to simply maintain their health insurance coverage. It is unlikely that we will see any major structural changes to our healthcare system in the short term, and so cost sharing remains a high priority and a high risk. The Patient Access Network Foundation believes that cost sharing should not prevent anyone from obtaining medically necessary treatment. Today, I'm going to tell you how PAN can help the underinsured obtain access to their medications. The PAN Foundation is an independent national 501c3 organization dedicated to helping federally and commercially insured people living with life-threatening, chronic, and rare diseases with the out-of-pocket costs for their prescribed medications. We provide direct support to patients who need copay, premium, or travel assistance by providing them with financial assistance through a grant. Since its founding in 2004, PAN has provided more than 700,000 underinsured patients over $2.5 billion in financial assistance through more than 60 disease-specific programs. The slide on the screen shows the types of available programs we have spanning the chronic, oncology, and rare disease space. I encourage you to check out our website, panfoundation.org, for a full listing of the disease categories, as well as the program's eligibility criteria and the list of covered medications. As you can see on the previous slide, PAN has more than 50 different disease-specific programs. To qualify for assistance, patients must meet the following criteria to be eligible. 1, the patient must be getting treatment for the disease named in the program to which he or she is applying. So if your patient has asthma, they must be diagnosed with asthma to qualify for the fund. 2, the patient must have health insurance, and insurance must cover the qualifying medication for which they seek assistance. This means that insurance must pay something toward the medication, and the person must have insurance, whether it's Medicare or commercial. Some of our programs may be limited to just having Medicare insurance or just having commercial insurance. We recommend that you reach out to learn more about the specific program you're interested in. 3, the medication must directly treat the disease. 4, the patient's income must fall at or below 400 to 500% of the federal poverty guidelines. This is fund specific, so each fund either has a threshold of 400% or 500% for the income level. And 5, the patient must reside and receive treatment in the United States. U.S. citizenship is not a requirement. It's important to note that the insurance and income pieces are different for each program, so we encourage you to inquire directly if you're interested in learning more. In order to apply, whether you use the portal or call PAN to enroll your patient, you will need a few pieces of information. 1, patient demographics, such as the patient's name, address, phone number, and email address. We also require a social security number if you are enrolling your patient through the portal. But if you're completing the application over at the call center, or if your patient doesn't have a social security number, our team will still be able to assist you. Next, we would need the diagnosis for the patient and the medication name, the patient's health insurance information, the patient's income and the number of people in the patient's household, and lastly, the physician's contact information. There are 2 primary ways that you can enroll your patient. 1, you can give us a call Monday through Friday. Our operating hours recently extended in 2018, so we're now open from 9 a.m. to 7 p.m. Eastern Time. Or you can log into one of our self-service portals at panfoundation.org. We have 3 portals, one for healthcare providers, one for pharmacies, and one for patients. Each portal is designed with the user group in mind. For example, the provider and pharmacy portals allow users to enroll and manage multiple patients, check claim statuses, and run reports. On average, it takes about 7 minutes to complete an application. You can give us a call or apply online. You input your information, and just within a minute, we'll let you know whether or not your patient has qualified. If your patient is enrolled, we'll provide you with the enrollment information right away, and the grant can be used immediately. This is especially important if your patient is at the pharmacy or needs to get their medication right away. You know they have coverage. We'll go ahead and always send the patient a hard copy in the mail with a welcome letter with a copy of their benefit card, and we'll also send this information to the patient's provider so they have it on record. If you have any questions at all about the enrollment process or you'd like to get started, please give us a call. Our call center phone number is 1-866-316-7263. Once your patient is enrolled, you can immediately begin submitting claims to PAN. We want the process to receive reimbursement to remain simple and quick for you, so we provide several ways to pay your claims. If the medication is received through the pharmacy can bill us instantly at the point of sale. That takes care of the copay, so the patient does not need to pay anything out of pocket. If the medication is received from the doctor's office can send us the bill electronically or by fax after it is submitted to the insurance company. And if a patient prefers to pay out of pocket, they can do so and file for reimbursement directly, and we'll mail a check to the patient once it's processed and approved. We'll make sure that regardless of the method that you try to seek reimbursement for us, that we communicate with you every step of the way. We have a dedicated claims team that will help you submit the claim, check the status of it, and make sure that you have the payment information. Assistance with PAN lasts for 12 months, and if you're a new patient to PAN, we also help you cover any claims you may have incurred in the last 90 days. If an eligibility period ends and the patient still needs assistance, we are happy to enroll them for another year of assistance pending fund availability. We know that every situation is a little bit different, so if you have any questions throughout the process, or if you're unsure if we can help, please give us a call. We're standing by to answer your questions and ensure you can get the help you need. By removing patients' financial barriers, our hope is that patients and their caregivers and family members can focus on what's most important, their health. Managing an illness is difficult, and people who apply for assistance from PAN may need support beyond copay assistance. They may have questions about their disease, treatment, side effects, and medication adherence. And they may benefit from connecting with the compassionate community that can help them deal with the physical and emotional complexities of the disease. That's why we align with leading patient advocacy groups to provide patients with the holistic support they need. These groups will reach directly out to patients who are interested in learning more. Another great resource we have is our website. We have designed specific sections for providers, pharmacies, and most importantly, for patients. By navigating the top menu bar, you can access audience-specific tips and tools to find program information. For instance, if you click the Patient section, you will see a list of all assistance programs and the eligibility criteria. You will also see referral information to other organizations if we are unable to assist you. Under the Provider and Pharmacy sections, we have frequently asked questions about how to enroll your patient in PAN and file a claim for reimbursement. We also have short webinars about our programs and tools to locate resources for your patients. Our goal is to help you find the support you need so you can spend less time on the paperwork and more time with your patients. An exciting development we had in the last few months is that we updated our portals for patients, providers, and pharmacies. So if you haven't checked them out yet, we encourage you to log in and see what's different. The PAN Foundation is one of many resources to help you and your patients. We encourage you to reach out to us so we can listen to your needs and understand how we can help. If you have any questions or if you're a patient in need, please let us know. Our contact information is listed on the screen, and we look forward to working with you soon. Thanks so much for your time and for all you do. At this time, I will go ahead and turn it back over to Carla.
Aisha, as always, thank you so much for taking time to share your expertise with the NeedyMeds audience. And no doubt the people who had the opportunity to participate today just got a little taste of why NeedyMeds is so proud to partner with the PAN Foundation. I do already see questions coming in, which I will bring to Aisha's attention in just a moment. In the meantime, however, keep those questions coming in, but in the meantime, I also want to take just a moment to point out or stress that NeedyMeds is also here to help you with any healthcare cost savings expenses you may be struggling with. I think Aisha will agree when I say that. That's why the partnership between organizations such as NeedyMeds and the PAN Foundation are so important, because we do our absolute best to help as many people as possible. And we want to make sure if we're not able to help somebody, for example, at NeedyMeds, we can refer them to PAN and vice versa. So we really do rely on each other. So remember that NeedyMeds is here as well to help you with those healthcare cost savings programs. I'm certainly not going to go over what's on that slide right now. I just wanted to use it as a snapshot so you can see some of our most popular cost savings programs. With that, Aisha, I do see some questions coming in. So one of the first ones, and while I ask Aisha the questions, I want to, of course, make sure you had the contact information for the PAN Foundation, as well as NeedyMeds, and you can see that at the bottom of your screen. So the first question coming in, Aisha, is, and you addressed this, but it may be something you want to stress and clarify, does PAN require any documents to complete an enrollment process?
That's a great question. So typically, no, PAN does not require any documents to complete an enrollment application. To apply for assistance, it's just information you need to provide us over the phone or just enter it into the portal. However, if your patient gets flagged for an audit, they may need to provide income documents after the fact. And if that happens, we'll reach directly out to your patient to let them know, and we'll give you a heads up too that we'll be reaching out to your patient. The audits occur for maybe less than 2% of our patients, so we need to reach out to them. So it's a pretty minor percentage and number of folks that need to follow up and provide us paper documents.
That's very clear. Thank you for addressing that, Aisha. Another question coming in is, I need help filing a claim to PAN. Who can I speak to?
Sure. So if you need any help filing a claim, we do encourage you to reach out to us directly. At our call center, we have a dedicated claims team who can walk you through the process on what to do. And we also have escalation support folks such as myself and my colleague Audrey Corti, who some of you may be familiar with. What we're able to do is work hand in hand with both providers and pharmacies to understand exactly what the concern is, if there's an IT limitation, or if it's something that you typically don't file paper claims and that's what you need to do for your situation. We'll work with you to make sure it can get done. So I can't emphasize enough, just please give us a call.
That's really very helpful, and I will piggyback onto that when it comes to NeedyMeds. I know that NeedyMeds, sometimes people find we're proud of all of the resources that we offer, but sometimes the NeedyMeds website can be overwhelming. So we certainly don't want anybody struggling to find what they need on our website, or you may only be going to one destination on our website, not aware that there's other places that you can check. So I'm going to piggyback Aisha's comment about not hesitating to reach out to the PAN Foundation and really stressing to call their counselors directly. And I would say the same for NeedyMeds, the call center as well. Another question coming in, and this is probably one you get a lot, Aisha. Do you have an estimate from the time an application or the enrollment is submitted to get the results?
Yeah, that's a great question. So it's pretty exciting. It takes about 30 seconds. It's done over the phone. And we have what's called instant determination. So as soon as you hit submit on the application or a call center representative tells you they're hitting submit, it's just a few seconds, and we let you know right away whether the patient's approved for assistance. If you submit a paper application, a few people do still submit us those, but not many, then we follow up with you usually within a day or two upon receiving it. But I encourage you to use the portal or give us a call, because it takes just about maybe 7 to 10 minutes to relay the information over the phone or enter it on the computer, and then you'll know right away what to do.
Thank you so much. And thank you to the audience member for asking that, because no doubt that's a question that has come up before and may have popped into other people's minds when the webinar ended. Another comment coming from an audience member is, unfortunately, they did reach out to both PAN and NeedyMeds for a specific need, dietary supplements like Glucerna, and we weren't able at the time to fill that need. One of the things I do want to stress is we're glad that you provide that feedback, because, and that's why I'm bringing it to everybody's attention, because both team members at the PAN Foundation and NeedyMeds, we really need to know what the needs of our users are to make sure we're doing everything we can to meet them. The other thing I will stress is, certainly at NeedyMeds, the programs that are listed on our website change pretty regularly. So if you have turned to NeedyMeds in the past to fill a specific need, and unfortunately we weren't able to meet that for you, I recommend trying back, again, by visiting our website or calling the 800 number, because the answer you got a couple of months ago may be different now. But again, any sort of feedback you're willing to share with both the PAN Foundation and NeedyMeds is very useful, because any feedback we can get from our users, again, helps us to determine the programs that are most in need. So a couple more questions, I think, directed actually at NeedyMeds, whether or not, actually, Aisha, this could be for both of us, whether or not we help with co-pays or also deductibles. And this is a great question. Certainly for NeedyMeds, depending on what your need is, your healthcare expense needs, whether it's medication or another healthcare expense, there are different programs available. So the answer in short is yes, we do have programs to help for both co-pays and deductibles. Whether or not we would be able to match it with a program for your specific need, I of course wouldn't know that. We'd need more information. But Aisha, do you have something you'd like to add about the difference between whether or not PAN is able to help with co-pays and or deductibles?
Sure. So all of PAN's copay assistance programs do help with deductibles. Specifically, all of the copay assistance programs cover deductibles, copays, and coinsurances. So if you're a pharmacy who's trying to apply for assistance and you're running a claim and you get a rejection because maybe the patient's in the deductible phase, just give us a call. It's something we can work with you hand in hand, and for medical providers, the same thing. It's just let us know, but we'll see it on the claim when you submit it.
Thank you so much. And again, thank you to our audience members for bringing up these great questions. I see one other coming in for NeedyMeds, whether or not if a person receives assistance from NeedyMeds, do they receive a card similar to a prescription card? So I'll just take a moment to clarify that NeedyMeds does not offer direct patient assistance. Rather, we connect you to programs that will hopefully help you afford them. And we make that connection free and anonymously through our website and toll-free helpline. Another resource that we offer, in addition to all of the programs we list, is the NeedyMeds Drug Discount Card, which can help you to save up to 80% off of your cash price of prescription meds. If you're interested in learning more about that, reach out to our 800 number or visit our website. On the left-hand side, you'll see a big square box with a bright red arrow that says get your NeedyMeds Drug Discount Card today, and you can learn a little bit more about that. I do see other questions coming in, really just about that it looks like whether or not we can provide further resources on, give you copies of the resources we presented in today's presentation. I will give everybody the heads up that in the handout section of your GoToWebinar control panel, there are PDF copies of both Aisha's PowerPoint presentation, which is the more important one, but as well as my PowerPoint presentation that also gives you some information about NeedyMeds. If you have difficulty accessing those handouts, don't hesitate to shoot me an email. You can do that. But you can reach me directly at Carla with a C, carla@needymeds.org. And for those of you that have submitted questions that we haven't had the opportunity to get to today, please know we will follow up with you personally via email by tomorrow afternoon. I want to thank everybody for taking time out of their busy day to learn a bit about the PAN Foundation, and we certainly hope you use them as a resource. Aisha, thanks again for your time and your expertise. Enjoy the rest of the day, everyone. Take care.